Hi, my name is Ed, and today I'm going to be showing you how to spike and prime an IV tube. So I'm going to be the nurse for my patient in 501 today. The doctor has ordered an IV solution for her. Before I go to her room, I'm gonna go ahead and gather all my supplies and get all my supplies in the bedroom. Once I'm in the bedroom, I want to make sure I wash my hands first before I touch all the supplies. At this point in time, I'm going to go ahead and compare, not compare, but verify um, the IV access as per order by the doctor. And before I go and get all my supplies, I'm just going to go ahead and mention the 10 rights of medication. If it's the right medication, the right dose, the right patient, the right route, the right time, the right documentation. I will document after I give the medication to my patient, the right of the patient to refuse the medication, the right assessment. I'm going to be assessing my patient before I give the medication. The right education. Of course, I'm going to be educating my patients as to the medication that she is going to be getting. And then the right evaluation. I'm going to be evaluating my patient before and after I give her medication. Now I'm ready to gather all the supplies. I have here an IV solution, the tubing, the time tape, and the tube label. Before I open the packaging, I'm gonna do my first check. I'm gonna compare the IV solution to the patient's medication administration record. I want to make sure it's the right medication, the right dose, or the right volume, or the right patient, the right route, and the right time, which the doctor has ordered for IV at 8 o'clock in the morning. Once I'm done with that, I'm going to go ahead and before I take the IV out of the bag, I want to make sure also that the order of the patient, of the doctor, also includes the IV fluid, what kind of IV fluid it is, the infusion rate, the duration, and the volume to infuse on the medication administration record. After that, I'm going to go ahead and take the IV bag off the packaging. I'm going to squeeze the IV bag gently just to make sure it doesn't have any tears or leaks. And I'm going to also want to check on the expiration date of the IV solution. At the same time, I'm also going to be checking for color, clarity, and the expiration date. Okay. I'm going to take the tubing out of the package as well. This package contains one whole tubing. The primary and the secondary tubing is not separated. It has the spike and the distal end. Then I'm going to go ahead and take the roller clamp and bring it all the way up towards the drip chamber, at least 1 to 2 inches away, and put it in off position. Okay, before I connect the spike to my bag, I want to make sure and do my second check. I want to make sure it's the right medication by comparing it to the MAR. I want to make sure it's the right medication, the right dose, or the right volume for the right patient, the right route, and the right time. Today, I'm going to be giving my patient a 0.9 sodium chloride as per order, doctor's order. Okay, now I'm ready to open and take the protective covering or cap of my IV bag. I'm gonna go ahead and carefully take the lid or the protective cap of my spike. I'm gonna go ahead without contaminating the spike or by touching it. I'm gonna go ahead and slowly insert it in the port of my IV bag. Once that's inserted, I'm gonna go ahead and hang the IV bag and the IV pole. And I'm gonna squeeze the drip chamber at least 1 to 2 times to fill the drip chamber at least halfway with the solution. Once that's done, I'm gonna loosen the cap on the distal end of my IV tube, of my tubing, I mean. All right. Now I'm gonna go ahead and fill the tube with solution. I'm gonna open the roller clamp gently. Once the tubing is filling with solution, I'm gonna make sure there's no air bubbles in the whole length of my tubing. If there is any air bubbles, just gently tap the tubing to release the air bubble. Now I'm ready to release the air bubble. I'm gonna go ahead and take the protective cap of my tubing and release the air bubbles on the sink. Let it drip. Let the solution drip for at least 2 to 3 drops until you get all the air bubbles out. Once that's done, I'm gonna go ahead and put the protective cap back. And make sure you check the tubing for any air bubbles if you get everything. Before I go to my patient's room, I want to make sure I put the time tape on my bag and the tubing label just below the drip chamber. And before I go to my patient's room, I make sure I I dump all the trash or the supplies on the proper receptacle and perform hand hygiene and log off from the computer or in the system. Once I get to my patient's room, I want to make sure I perform hand hygiene, OE wipes, provide privacy. I want to make sure I do my third check for my medication and compare it to the MAR if it's the right medication, the right dose or the right IV volume, the right for the right patient, the right route and the right time. I'm gonna of course introduce myself to my patient, and I'm gonna educate her about the medication that she's going to be getting, asking her if she has any questions, or if she has any allergies or any concerns, or if she wants to get the medication, or if she refuses, she has the right to refuse it. I'm just going to document the refusal in the nursing notes later after I'm done, and then I want to make sure I evaluate my patient, assess and evaluate my patient. before and after I give the medication. Um, since everything is good, the patient is okay with me giving the IV medication to her. So I'm gonna go ahead and um, give the medication. And after that, I want to make sure I gather all the supplies that are not needed and dump it in the correct receptacle. I'm gonna wash my hands and open the curtain and make sure that the patient is safe by providing the collect button, um, the tray table within reach, any personal items, the bed all the way low, and side rails up as per facility policy, and just ask my patient if she needs anything, and then there's none, thank the patient for letting her do your medication or your medication administration today, and make sure you come back and check the patient after like 30 minutes or an hour or after the medication is done. Thank you very much and have a great day.